I'm Dr. Kweyamba Vainey. I'm a medical officer special grade in Mulago Hospital, National Referral Hospital. Specifically, I work in the Department of GIT Surgery, and I work as a Hepato-Biliary and Pancreatic Surgeon, and also as a laparoscopic surgeon. But today, I'm talking about the Endoscopy Unit because I also work in the Endoscopy Unit of Mulago Hospital, where we do endoscopies. And the Endoscopy Unit of Mulago has been there for more than 20 years. And over time, it has worked on so many patients. So in the endoscopy, we do three major things. One, we diagnose disease of the stomach and esophagus. We put a camera through here and we look into the esophagus. We also use endoscopy to diagnose the disease of the colon, and we pass the camera through the anal area and we look at the colon. In so doing, we can know what is really paining these people. Many people come and say we have ulcers, the ulcers are not healing, the ulcers are due to H. pylori, yet they are not due to H. pylori. Sometimes that pain you feel in the stomach may be another issue. It may be a cancer, it may be candida in the esophagus, so many things. So the endoscopy helps us to know exactly what is causing this pain in the stomach. We put the person to sleep a bit, not so much, so that he doesn't get a problem, discomfort when your camera is being passed. And then we take our time. In the upper, we can take even almost 5 minutes to look carefully up to down in the stomach. And also in the colon, we take around 30 minutes to look carefully what is causing this problem. And once we find the problem, we can now know what to do, what to treat. So many people are treating things they don't know because they are not doing these endoscopies or colonoscopy. Some of the diseases which we find, we can treat on endoscopy itself. And that's what we call therapeutic endoscopy. For example, some people may have ulcers which are bleeding ulcers. And those bleeding ulcers need us to clip them or to seal them so that they stop bleeding. And that one we can only do it through endoscopy. And the endoscopy, we don't cut anywhere. So there are diseases we treat with endoscopy, and someone may even think we did nothing, but when we have done so much for them. And also when we find that most probably the problem is maybe like cancer, we take off some samples to confirm, so that the person who's going to operate the cancer knows what to do. So right now, as we are standing in our endoscopy unit. It is a big unit. We do more than 10 endoscopies per day. That means five days a week. Anyone can come in and book an endoscopy, and we work on it. So Mulago, we are really blessed to have this service. Yeah. So, and we have so many people doing it. No, I'm not the only one. We have surgeons, physicians. It's a team of like 6 to 7 specialists, all of them knowing how to do endoscopy and colonoscopy. So that at any particular part of the week, endoscopy is being offered. So as an ASOU member, ASOU is Association of Surgeons of Uganda, and also a Mulago employee, it's very good to show what surgeons can do and why these services, surgical services, are important, and people shouldn't fear them because they help them.